Good evening, everybody out there in social media land. I'm here for another installment of Medical Talk in Layman's Terms with Nurse Charlene. And I'm the host, Nurse Charlene. Welcome on in, you guys. Tonight's topic is Alzheimer's disease versus dementia, like you see on my board, but I got it backwards and stuff. But either way and stuff, it's dementia versus Alzheimer's or Alzheimer's versus dementia. We're about to find out what's going on with that. What is that and stuff? Just like if you have mental health or mental illness problems or something like that and stuff. Everybody ain't crazy because crazy ain't a word, and stuff like that. But you call them crazy because you don't know if it's schizophrenia, you don't know if it's bipolar, you don't know if it's regular old depression, you don't know if it's PTSD or whatever and stuff like that. So you just say they crazy. Well, what is you? So we like to dive on in a light and airy, non-judgmental platform and talk about this stuff and have medical discussions so that when you leave out of here, inside the title, Medical Talk in Layman's Terms with Nurse Charlene, referring to layman, keeping it simple so that somebody that knows nothing about medical can get something out of it. They might not be perfect, but somebody that actually is, all up on it and stuff, and they're medical out and stuff, even they can find a joke in this, and stuff like that, but also knowing that it is serious and stuff, and that it will affect probably 99.9999% of everybody that's, here, and everything. Welcome on in, Miss Sandra and T. Thank you, ladies, for coming on. I appreciate you. I'm going to get into some dementia versus Alzheimer's or some Alzheimer's versus dementia and telling you what those are and why they're actually different. But I don't want to give it all away and stuff because I do got to do my podcast disclaimer and everything and stuff. But welcome on in, ladies and stuff. I appreciate you. And anybody else that comes on, it's all right and stuff. Y'all take y'all time, but y'all better get on before I start getting to the good part. I don't do no repeats and stuff, so I'll do a little bit of going over it. But once I dive in, I got to go on straight through so that we could get on in and off of this and to our nice little beds and stuff and get comfortable for the night and everything. So as I go in, let me just make sure I put one person on. Yeah. Okay. So Miss Sandra said, good evening, Nurse Charlene, Rosie, and Britt. T and I are on board. Thank you, ladies, for coming on board. All right. So before I start my topic tonight and everything, which everybody needs to know and stuff, and look at the board while I'm, reading the podcast disclaimer and stuff, and it got little fingers and stuff. I like them little fingers and stuff pointing at stuff, but it got a regular brain, and then it got a brain on Alzheimer's or Alzheimer's on the brain and stuff like that. Then it got some things that you lose, and stuff like that. And these might be common to some people if you've experienced it with a family member or yourself, but mainly a family member and stuff like that. So it's serious enough and everything. And I want to keep it kind of light, but it's a very 911 serious type of thing and stuff. And I'll let you know about that and when to actually go to the hospital. If you got this, and this, yeah, it's time to go. Let's get it checked out. We get it early, you got a better quality of life. We get it late, it's some trouble. Okay. So welcome on in, you guys and stuff. So welcome to Medical Talk in Layman's Terms with Nurse Charlene, where health and illness are broken down into simple, easy to understand conversations. This podcast is for educational and informational purposes only. While Nurse Charlene is a licensed registered nurse with extensive healthcare experience, the information shared here is not intended to replace professional medical advice, diagnosis, or treatment. Every person is different. What works for one individual may not be right for another. Always consult your doctor, nurse practitioner, or qualified healthcare provider with any questions you may have regarding a medical condition or before making changes to your health, medication, or your lifestyle. What works for one might not work for you. If you think you may have a medical emergency right now, call 911 or seek immediate medical attention. Always do that. And I just wanted to bring this up. You know, when you get on the phone, you call the doctor's office or something like that, you on the air and stuff, and they say, if you're having a medical emergency, hang up and dial 911 and stuff. That's what I'm talking about. You hang up and dial 911. You get off the podcast, you get, off the scrolling and call 911. Take care of yourself because you might not live to scroll another day. So we got to make sure that we're taking ourselves serious so that we can be here for the long haul and everything. So that's where that comes in at. So the views shared on this podcast are based on professional experience and general medical knowledge, presented in layman's terms to help bridge the gap between healthcare and everyday understanding. By listening to this podcast, you acknowledge and agree that this is not a substitute for personalized medical care. No provider-patient relationship is established, and you are responsible for your own healthcare decisions. You gotta be. You don't want somebody, a stranger or me, and stuff. I'm not in your household. So if I was in your household, you might lean on me a lot more and stuff like that. And yes, I'll give you the right answer. But at the end of the day, I'm sending you to the hospital or I'm sending you to make a doctor's appointment. So guess what? I'm going to do the same thing that anybody else would do and stuff. And I'm not going to sit there and try to act like I know. I don't have x-ray vision or CT scan vision. So I'm going to send you to the hospital where they got machines and different people that conduct all of that. Okay, so remember, your body speaks. Your body's a snitch. Believe it, listen to it, respect it, and when in doubt, check it out with a medical professional. Thank you for tuning in and taking a step towards better understanding of your health. Thank you guys for tuning in. I appreciate you. Welcome on in, Dad. I see you on there. Say hi or something. But anyway, I'm talking about Alzheimer's disease versus dementia, or the other way around, dementia. It doesn't matter. We're going to talk about them and everything that's up there. So you see the little brains and stuff like that. I'm going to give you a whole bunch of information that's going to kind of fit what I drew up there. And you see, I'm really working it out. Dad said hi, everybody, and stuff. Hi, welcome on in and stuff. It's okay and stuff. I'm just gonna be talking about Alzheimer's and dementia, and we should at least know about it because that's half the battle. Knowledge is power, and knowledge will keep you alive a lot longer than not knowing nothing and ignoring it, and everything. So that's where we're at. So the introduction. Many people use terms Alzheimer's disease and dementia as if they mean the same thing. Wow. They are related, but they are not identical. They are related, but they are not identical. Think of it this way. Dementia is an umbrella term. And so I want to talk about that umbrella term. Oh, Dad said, yes, indeed. That's right. It's an umbrella term, dementia. But I'm going to give you some examples of other umbrella terms. So dementia is the umbrella term. That means all these group of symptoms that you have and stuff, it explains dementia. But dementia is not a illness. Dementia is like, black, or something like that. It's not a, black is a color. Dementia is this. But also, I wrote this down and stuff because I wanted to say it's an umbrella term for dementia, but also glaucoma. If anybody knows about the eyes and stuff. Yeah, I know. But anyway, glaucoma. It's a group of eye diseases and disorders and stuff. So glaucoma is not, I got the glaucoma of my eye. Yeah, you could say glaucoma because you got this many symptoms of eye things going on and stuff, but it's not the actual disease. The actual disease would be your cataract, your detached retina, and stuff, your uh, optic nerve inflammation or something like that and stuff. Those are actual things that glaucoma covers, but glaucoma is not a thing like dementia is not Alzheimer's. Alzheimer's kind of copies off of that, and everything, but you'll find out tonight. And then also, like when we say heart disease, that doesn't automatically mean this or that and stuff. It's heart disease. That means it's a disease of the heart. There's many diseases of the heart, like congestive heart failure. There's coronary artery disease, and things like that. So it's not dementia is just a group of things. They didn't come up with a word like if you have schizophrenia plus a little bit of depression plus a little bit of bipolar depression and all of that stuff, and the anxiety disorder and stuff like that. Dementia is like saying crazy to all of those. Like, you crazy. Yeah, crazy is not a word. It's a bunch of symptoms that we think, it's a slang word, and it's actually derogatory. It's mean to say that. Like saying you retarded. Just because you're slower than somebody else or you receive information and do things, differently, that doesn't mean that you're crazy or you retarded. That means you take it in a different way. You might be a rocket scientist, but you go slower than somebody else and stuff. So that's what that's talking about and stuff. So it's easy for us to do that. And I did it in the past, and stuff. They're going to give me this patient or that patient and stuff like that. But they're not the same. So that's the whole point of that. So getting back in, think of it this way. So I said dementia is the umbrella term. Alzheimer's disease is the one type of dementia. So it's a type of dementia, but Alzheimer's is an actual disease and a diagnosis. Dementia is a whole bunch of symptoms and everything. So it could be anything. So moving on. So what is dementia? Dementia is not one specific disease. It's a group of symptoms that affect your memory, your ability to think correctly, your judgment and everything on making those decisions and stuff like that. Your problem solving. You can't even problem solve if this is going on and everything. Your language. You can either stop talking at all, or when you talk, it's what they call gibberish. You're not making sense to a person that's supposed to be normal and stuff. You're not making sense. Or your behavior. You could be real angry and lash out at people because you don't understand, or you can be really calm and don't say anything, and then they know that something kicked in. And also it affects your daily functioning, like the ability to get up and know that you need to get up and eat breakfast, brush your teeth, eat breakfast, sit down so that you don't choke. Don't, leave the stove without turning off the burners, different things like that. It's simple things, but you lose these things. It starts affecting it. So that's when you know that, something going on and everything. I need to get them some help. And so dementia becomes serious enough to interfere with everyday life. Examples of it would be examples of dementia would be Alzheimer's disease. So you see, they're not the same, but they're very different. And I'm going to give you some more of that and stuff. I don't want to get ahead of myself, but a type of dementia is Alzheimer's disease, is vascular dementia. It's also one called, and I'm not going to give you all the definitions to these, but I'm just saying Lewy body dementia and everything. Then there's one called frontotemporal dementia. Frontal lobe of your brain and temporal is your temples. So frontotemporal dementia and everything. And that means something, but I don't want to go that deep and stuff. It's a lot. It's a lot. but I'm going to give you some good stuff. And then there's mixed dementia. That means it don't know which way it want to go, but it's giving you everything. It's lighting up the board on all of them, and stuff like that. So that's where that comes in. What is Alzheimer's disease? Okay, Alzheimer's disease is the most common cause of dementia, because dementia is symptoms. So you see where I'm trying to go with that, to try to open that up for you and everything. It is a progressive brain disease that slowly destroys your brain cells. We need all of them, every single one of them. And we probably lost some along the way, but we need them. And whatever ones you got left, you lucky and stuff, and we need those, and stuff. So how do we, work this out? Well, I'll tell you. Over time, a person loses, in Alzheimer's, of course, a person loses memory, the ability to think, thinking skills, communication abilities. They might just go silent and don't talk at all anymore, or they might talk and it's gibberish, or it doesn't make sense. They're putting a cat with a fish and a tree and a apple, or something like that. It just doesn't go and everything. And then there's independence. It takes away your independence when Alzheimer's starts kicking in and everything. So that's why it's good to know your family's medical history, because it'll let you know what you could dodge and what you can't, but you could be ready for it. Okay. So Alzheimer's accounts for approximately 60 to 80% of all dementia cases. You see that? So dementia, it said cases, but it's saying dementia thoughts and stuff, the process. You're explaining Alzheimer's, but they're two different things. One is symptoms and one is the actual disease that uses all those symptoms to let you know that this is what's happening to you. Okay. So some differences, if we want to do Alzheimer's versus dementia. For dementia, it's a general term. Dementia, crazy, colored, black, orange, and stuff like that. Alzheimer's, it's a specific disease. It got a name. It's a program. It's a disease process. Dementia, it has many causes. Alzheimer's, it has one cause, dementia. See? So that's the differences. Dementia is a collection of symptoms, not a disease, a collection of symptoms. And Alzheimer's is a progressive brain disorder, disease. It's a progressive, meaning it's one thing after another, after another, after another, till it gets so high that, yeah, it's very special for anybody that even is dealing with that in that type of way. So then dementia, there's several types that exist, and Alzheimer's disease is the most common type. Oh, oh, that scared the mess out of me. Oh, I'm done. Okay. So then, yeah, go over there and no, you don't even have to do nothing and stuff. It's just player hating. I've been fighting with that all week. So then we got dementia. Some causes are reversible. That means that dementia, it's a difference. It's reversible. Whereas Alzheimer's, there's not currently a reversible cure for it. There's something that slows it down, but there's no cure for it. See, dementia symptoms, so you can you got medications and stuff that, and treatments and stuff to help you reverse it, where you could get some of your groove back. Whereas when it's Alzheimer's, progressively, it's just going to keep on going till it take you. But you could decide how it takes you by if you tell on it, if you snitch on it, if you tell what these symptoms is, they catch it early enough. There's certain medicines that keeps it at bay, but it is going to do what it does, and everything and stuff. So that fact is clear and stuff. So that's definitely a big deal. So then what happens in the brain during Alzheimer's disease? And that is two abnormal proteins build up. I'm not going to go all the way into them and stuff, but it's a amyloid plaque that's sticky clumps between the brain cells, causing it to jumble all up and stuff like that. And then the cells become not useful to you and everything. And then it has some other stuff, some tangling and fibers in the brain, and it starts breaking the brain down. That's why it's so bad. It's a disease, and it's not currently reversible. Because how do you break down these proteins that are, in your brain causing trouble, and everything? So that's where that is. And so the changes to the brain by these tangles and these plaques, protein buildup plaques and stuff, is it causes the brain cells to die and brain tissue to shrink. So that's why I put a big dementia brain and then a significantly smaller, not too much smaller, because I want you to still see it and stuff. And so that's why that's on there and stuff. Welcome on, Auntie Josie. She says, sorry for being late, but I'm here. Hope everyone is doing well. Well, thank you. We hope you are doing well and stuff. And no, it's not a late thing and stuff. You're not late to class, but I do want to be able to interact with you whenever I can and stuff. So no sorry and stuff. It's just you come on in and stuff. And anything that you might have missed, you go back and you watch the replay and stuff, and you already know how to do that and stuff. But I appreciate you coming on, and it's all right because everybody got something to do, and everything and stuff. And I understand it, and I'm very understanding in that way, and stuff. I have no problem with that, but I know that you want to find out what's going on. So this is where, you can really find this out, because you never know when it's your turn to come across this, and stuff like that. So that's the good part and everything and stuff. So yes, welcome on in, my dear, and stuff. So I told you about that. In Alzheimer's, they cause the brain to actually shrink. What grows your brain back? Nothing. That's why it's not really reversible. But you can keep it at bay so that it doesn't shrink down fast, and stuff. Because we could do things to make it go faster and progress. And either one, or get worse and everything. Some of your risk factors and causes. The number one risk factor cause is aging. It's one of the biggest risk factors, and the risk increases after the age of 65. So anybody over 65, just pay attention. It didn't say that you have to get it, and stuff. Just pay attention. Everybody's different. Body is different. So just let you know that when you start really, really forgetting stuff, and you just for the darn to tell on it, tell somebody, tell your loved one, somebody close to you, hey, I'm starting to really, this is concerning me. I didn't went to the store and I forgot why I was at the store. I don't know if I was supposed to have a list. I don't know what I was supposed to, or something like that and stuff. Then it might be something, an area of concern. But if you catch it right then and there when you see that and stuff, then guess what? You get to live a better quality of life, because they got medication that can slow it down if it is Alzheimer's, or even if it is dementia, and dementia is reversible. So you can actually get it reversed and stuff like that and stuff. So there's some hope, and stuff. It's not just a death sentence and everything. So then family history. That's a risk factor or a cause, and everything. The risk increases if a parent had Alzheimer's, or if a sibling had Alzheimer's and everything. So family history, aging, family history, genetics. It's in your genes, certain genes. And I was going to say it. Okay, I'll say it. APOE-E4 gene. Everybody ain't gonna know what that is, but I put it out there for just in case any medical people is on here and stuff. That's a gene that causes, or puts you at risk for Alzheimer's and everything. And having a gene does not guarantee that someone will develop Alzheimer's, but you're in the know now. So you might not even get it. But if you told on it, you the one to have to battle. You get to live you a good life and everything instead of a bad one and not knowing nothing and everything. So then, so I said aging, family history, genes, and then number 4, heart and blood vessel problems, because there's a vascular one. Oh, okay. I didn't jump ahead. Sorry, you guys, and stuff. So poor circulation affects the brain, because guess what? The brain needs something. Guess what it needs? It needs blood. And this blood that comes to it, it needs to have oxygen. And because the brain needs oxygen, it needs the nutrients that's found inside blood, and it needs all of this stuff to constantly be fed to it, or your brain dies, and it's called a stroke. See, that's why you have a stroke, because the blood clot gets in the way of inside that vein or somewhere in there and stuff, and clogs it up, and then your blood is not flowing to your brain correctly. So wherever it stopped that vein from getting to your brain, it's going that part of your brain will die. It's called a stroke. It's called a brain attack. If it goes to your heart and some clogs it up and stuff, and you can't get all the blood flowing to your heart, that part of your heart that doesn't get that oxygen and nutrients and everything and stuff, it dies. It's called a heart attack. Brain attack, stroke. Heart attack is when the same blood clot plugs it up, and then you can't get that blood there. Welcome on in, nephew Romero, Pastor Romero. Thank you. He said that's good. That's right and stuff. So that's number 4, heart and blood vessel problems. And then what else? Oh, okay. Some examples of heart and blood vessel problems. Guess what? High blood pressure. Didn't it say high blood pressure? That means you putting all that work on your heart. It's high. It need to be medium. God made us that way and stuff. He said the heart don't have to do all the work. You got your brain that do some work. You got your lungs that do some work. Everything do some work and stuff. And if the pressure is so high and it's constantly, it weakens the walls of your heart, causing things like aneurysm where it'll blow up like a balloon in one spot and stuff. It can't do that, because guess what? It gets to pop. And then if all the blood dump out of there, it's not going to you and all the places inside of you. So guess what? You go to sleep for good. Anybody, me, you, everybody and stuff, that's a human being and beyond and everything. So high blood pressure is one of the examples. Diabetes. Because the sugar that's in your body, I was explaining this, the sugar, you need sugar. So I'll never eat sugar. No, it's not that you never eat sugar. You can have the slice of cake. You're going to eat the whole thing and don't share with nobody. That's what it is. It's the whole cake eater, not the one that has one Twinkie, the one that eats all 12 of the Twinkies in a box in one sitting. So you see the difference? A Twinkie one time a day, or the person that eats 12 Twinkies 3 times a day. Which one gonna get diabetes? Probably the one that one time a day. Yeah, no. It's the one that does it in excess. It's just like with high blood pressure. It ain't that you can't have salt. Your body needs salt to regulate your fluids in your body and stuff, so everything's circulating right. You don't get edema where your legs and ankles swell up and all of that type of stuff. But if you have too much, you putting salt on every single thing, it's a problem. Welcome on in, cousin Tony. It's okay. Come on in, baby. She said, hey, all, it's Tony checking in. That's right and stuff. Check on in. We're talking about dementia versus Alzheimer's and stuff. So come on in and everything. And another one. So I said high blood pressure, diabetes. These are all vascular problems or heart problems and stuff like that. And one is high cholesterol. Why do you think they want you to eat your Wheaties and your Cheerios and all of this stuff and take atorvastatin and Lipitor and blah, 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 and all of that stuff? Yeah, those mean something. The reason why they want your fatty down and stuff, because you could get this thing that you develop called plaque inside your arteries. Your arteries need to deliver that blood to everything and stuff. Huh? Got a little. Oh yeah, cholesterol. I'm sorry, you guys. And so I'm trying to read and do it at the same time. Yes, Antoinette and stuff. Yeah, even if you got a little bit and stuff, you can correct it. It's correctable. So definitely you good and everything. Welcome on in, Pastor Carol. She said, "Good evening, Nurse Charlene." All right and stuff. Good evening, Pastor Carol. And stuff. Welcome on in. We're talking about dementia versus Alzheimer's because they're two separate things. One is symptoms, one is the actual disease that's caused by dementia. So, but dementia don't get its own little thing and stuff. It's a umbrella for all types of things and stuff. So, definitely y'all want to go back and do the replay and stuff, but I might end up going over it anyway while I'm on here and stuff. But welcome on in, you guys. Y'all getting good right now. Getting to the good part and stuff. So I said high cholesterol. Then also welcome on in, Auntie Linda. She said hi, everyone. Hello. And Pastor Carol said yes, this month is awareness. Absolutely. See, you didn't already. Yep. But you know what? Another thing is the reason why I'm doing this one is because a childhood friend walked up to me this weekend and stuff. Oh, I forgot to talk about it, so I'm gonna talk about it now and stuff. This weekend, I was doing a community service event for with Pastor Carol, that's on here and stuff. And it's her Joy Project. They had this thing called the 6-2 day and stuff, you know, for 62nd Avenue and stuff like that. And it's a nice little thing that she does annually where she, you know, treats the kids to all these community services. And I was there as the resident nurse, you know, because I grew up on the same street in the same area, you know, since 7 years old. And I'm only 21 now or 27 or something like that. Plus 27. But anyway, I'm saying all of that to say that we were able to diagnose and not diagnose, I take that back. I was able to inform somebody to check out their blood pressures with the doctor and stuff. So just in case, if they find out early, guess what? You get to reverse it. But if you don't find out and you don't talk about it and everything and stuff, then there's a problem and everything and stuff. So, oh yes. So Pastor Carol said our neighborhood 6-2 day sharing joy and community awareness. And, you know, being that I'm around and I grew up there with all these people and stuff, it was like a really nice little festival type thing and stuff where we were able to, you know, give to the kids, and they had a little petting zoo and all of this and a jumper outside and snow cones and all of this stuff. They were doing some really, really sweet things for the kids. They, you know, so much bad going on and stuff that when you get a chance to do something good and stuff, you know, that's something that, you know, thank you. I tip my hat to Pastor Carol and her Joy Project that puts on and sponsors these type of events annually and stuff. And I thank you for allowing me on there and stuff as a resident nurse and stuff, because they were paying attention. The adults were getting their blood pressures taken. They were, you know, serious. They was listening to what I had to say about it, that I wasn't just there and stuff, that I was actually doing some work and stuff that would help them. And that's more life saved, you know, or more people aware and everything. So definitely that was a big deal and stuff. But that was just a sidebar. Going back to what I was talking about, which is risk factors and causes of Alzheimer's. And so I said high blood pressure was one, diabetes was one, high cholesterol was one, stroke, you know, and stuff, because diabetes causes that sticky sugar that's supposed to go inside your veins and inside your cells and give your cells energy to help you move. And you need cell and that energy from sugar to move your hands, to wave, to, you know, to move your head, to stand up, to walk and everything. Welcome on in, cousin Maria, my sweet little Maria. She said, hello, good subject. Yes, this is good, she said, and stuff. Yes, and it's very important because we need to find out because we're all going to figure it out one day that we got to go through it. So why not know ahead of time so you can increase the ending of your life, and stuff when it's time, when it's getting up to that time, when it's time to go home and stuff, at least you had a good, run at it and stuff before you left this earth, and stuff, as opposed to all broken down, you don't know what's happening and stuff. And for the people that are already dealing with it and it's too late for that and stuff, it might be too late, but I got some stuff for you guys. So just, listen on up and get on in here and stuff. Cause I got some stuff for the people that's dealing with it. It's too late for all this. I'm talking about getting there early and stuff. They already got it and stuff. I got something for that. Okay. So welcome on in, you guys and stuff. So, I said stroke and stuff, and that's when, a blood clot, usually it's the most common one is the dry stroke, which means that a blood clot blocked the way, like ain't no blood getting through here. So guess what? It needs constant blood that carries oxygen and nutrients to it so that it functions right and you think right. When a stroke occurs, it then got up in there and held everything up, and player hated on the blood that's trying to come up and feed the brain. So then guess what? That part of the brain that doesn't get that blood dies and stuff, and it only takes minutes. That's why they want you to get you in there. When's the last time you was normal and all of this stuff, and look for these symptoms and all of that stuff. So this is a really important thing because guess what? They all go together. They all go together. Every time I talk about your GI system, gastrointestinal system, or your genital urinary system and all of that stuff, they all make sense. And that's why, because they're all a part of you, inside of you. And everything. Some are different, abnormal and stuff. Whatever it is, you're still a human being at the end of the day. And that's who I'm talking to and everything. So then, what else did I want to say? Also obesity. So remember I said high blood pressure, but also, unfortunately, and this is not to talk about anybody that's overweight, because that's the obesity is when you're overweight. You could be overweight and then you could be obese. And that's morbidly obese, meaning deathly obese. That's, somebody 400 or 500 pounds and stuff like that. Yes, I know you didn't want to be that and stuff like that. I understand that, just like somebody don't want to be skinny because they could be at risk for dying quick too. Just because you're skinny doesn't mean you get to live any further than somebody that's, extremely large. It just means that you got to take care of your body no matter which one you're in. And everything. So that's where this comes in and stuff. And the part about obesity, you're putting extra pressure on your heart because your body has to. Yes, Pastor Carol said 400 pounds or more. Yes, that's a lot and stuff. It's way past your, and stuff. And I don't care if you're 7 feet tall, if you 300 and something pounds or 400 pounds, 500 pounds, pushing 500-600 pounds and stuff, it's a problem. Because you guess what you got? That same little old tiny heart, and then it starts deforming because they got to try to keep up with you because they got to push blood around this big giant body, and stuff like that. So that's the problem and stuff. So then it's more pressure on it. It's weaker. The walls are weaker and stuff. So it ain't got that good heartbeat that you want. You start drowning. Yes. And it can cause heart failure, fluid volume overload. That means too much fluid in you. Too much even blood in you. A person is supposed to have this amount of blood or whatever and stuff. And you have, just about that and a half more, and stuff, meaning that your body got to work like that. But guess what? You was born with that same heart, it got bigger as you got bigger and stuff. But after a while, it gets, bent out of shape. It stops functioning correctly. And that's what puts you at danger for death. And everything is because it can't keep up with it. It can't keep up with the larger side. Yes, congestive heart failure and stuff. So those are the big things and stuff. Thank you, Pastor Carol. Yes, those parts and stuff. And then another one that's a problem. So let me just go back real quick and say a risk factor and cause of dementias and Alzheimer's is aging is one. Anything after 65, just look out. I didn't say you got it or some, look out. That's all I'm saying and stuff. Family history. If it was ran in your family, your parent or your sibling, you want to pay attention. That's all I'm saying. Genetics. It's in your gene. You can't do nothing about that. You got to just go ahead and work it out, and stuff like that. But get it checked because it doesn't always mean that you're going to get it. Even if you have the actual gene to turn to Alzheimer's, that doesn't mean that you'll actually turn and convert to it. You might get away with it, but at least have it checked and stuff. Make sure you don't have it and stuff. Heart and blood vessel problems. That's where I said the high blood pressure, diabetes, high cholesterol, stroke, and obesity. And then number 5, smoking. I know cigarettes ain't that bad for everybody, huh? I see so many people smoking cigarettes. I guess they probably good for you, huh? Okay. But anyway, I'm being sarcastic and everything. But smoking damages blood vessels and brain tissue. Start doing smoking cessation. They got Nicorette gum. They got some stuff. Take some steps, and stuff. You don't have to just. It took years to build up to get to a pack and stuff. It can take years to bring you down. But if you start bringing yourself down, the less you smoke, the more chance you got at making it. As opposed to, I'm just going to smoke until I get up out of here. It's too late for me. It's too late. If you say it's too late, you put it in the air. You claiming it, and stuff. So, yeah. And Pastor Carol says smoking is bad. It's absolutely bad. It got a lot of things wrong because it don't just affect that and dementia and Alzheimer's. I'm talking about that and stuff. It affects your lungs. No air, no breathing, no, the cousin Tony said, Antoinette said, yeah, I haven't had a cigarette in 5 years. Absolutely, that's wonderful. There's a couple others and stuff. I think Sandra hasn't had cigarettes in a long time also and stuff, or a little while and stuff. She got it together and stuff, and it's not to say that nobody else can, just because I'm saying that. I'm saying it could be done. If somebody else did it, you could do it too. And stuff like that. So that's where that comes in and everything. And it can help reverse some of the damage. Absolutely. Pastor Carol said it can help reverse some of the damages to do smoking cessation. But it doesn't have to always come like, I just got to stop. I ain't going to buy no more. That's just like telling somebody that loves soda, I'm just going to drink Kool-Aid. And stuff. Yeah, Kool-Aid just as bad as soda. It just got bubbles in it, but they sugar. But anyway, I'm saying all of this to say that it can give you a fighting chance. That's a better way of putting it. So that's smoking and stuff, but it's because it damages blood vessels and brain tissue, and you don't want them type of problems. And then lack of exercise. What? So I got to exercise and huff and puff if I want to not have dementia or Alzheimer's. Yeah. Yeah. You got to get on down. You got to lift some weights. You got to walk. You can walk in place. Even if you got a treadmill, you're fortunate enough to have a treadmill. I found out you don't even have to run. You could just walk on the treadmill and you get to live and stuff to fight another day and everything. So that type of stuff. And everything, and taking these walks. You see so many people taking their walk. They walking the dog, and so no, they walking themselves, and they using the excuse of the dog. You don't know what they found out. Maybe they went to the doctor and stuff, and they found out that I walked the dog, and I walked me too, and then I could live to take care of the dog, or whatever and stuff. But I'm saying, and stuff. Yeah, some people is walking for their life to save their own life. They found out. And stuff. And then poor diet. I know all of you probably don't have poor diets because I certainly never had a poor diet and stuff. I don't even know what sugar is and processed foods and Lunchables and deli meats and sandwiches and all of that stuff, McDonald's and Taco Bell and all of that stuff. I know all of those are healthy and stuff. And saturated fats, that's just fat that it say it, saturated. Yeah, it means it's the lazy plaque that get up in them arteries so that you can pass the blood all the way to your brain and then pass the other blood all the way from your neck down, to the rest of your body and stuff. And your whole body needs blood and stuff. And it can't even get it there because it's all caked up inside of there and stuff. Yeah, so that's saturated fats. You got to lower the cholesterol and everything. And so it will increase the risk of developing these things. And also a head injury. Wow. A head injury? Repeated concussions and traumatic brain injuries can increase risk later in life. Absolutely. That football star that was, they could take a pounding and stuff, but they could give one too and stuff. And that head just be hitting and hitting and hitting and all of that, and game after game, year after year and stuff. That's why they retired. You ain't never seen no 40, 50-year-old on the field and stuff. They can't handle it and stuff, especially if they snap that head is going back and forth, bloom, bloom, I'm just saying. So even that is a problem that will put you at risk or cause dementia / Alzheimer's, and everything. Alzheimer's disease. One is the actual diagnosis. One is all of it put together that Alzheimer's does. It's all of them put together, but they have different causes. They have many causes for dementia. It's only one cause for Alzheimer's, and that is dementia. So that's where that comes in at and stuff. So I was just looking at everything, making sure I see you guys and stuff. The age groups most affected by dementia or Alzheimer's, mainly on Alzheimer's, is ages under 65. They're rare but possible, and it's called early onset Alzheimer's. So you might have a gene and it might set in early depending on your lifestyle. That's why you see people changing. They went from this and now they're switching up and everything because it's no hope for us, if we don't start trying to change it and stuff, or even have just the mental capacity to try to change it so that we can get to that point where we can, take care of ourselves. So that's where that comes in at. So then ages 65 to 74, risk begins increasing significantly. Risk, not that you got it, but the risk of getting it increases. 75 years to 84 is moderate to high risk, and memory problems become more common. 75 to 84. And then 85 plus is the highest risk group. Yeah, you got to find out. When they start getting up to 85, you got to get them going and stuff. But I'm going to tell you the hope in there, because it is some. Cousin Maria said, can a head injury cause it to come on? Absolutely. It's called multiple concussions. And they end up calling it traumatic brain injury because it's so many that your brain, it's in the side of a skull. But after a while, even though you have that helmet on, it's still pounding up against there. That's like taking a bat to a helmet and stuff and pounding on it. After a while, it's going to wiggle your brain like shaking baby syndrome or something like that. It wiggled that brain up in there so bad and stuff, That's why they end up going like crazy, these football players and stuff. Welcome on in, Rosie Granny Allen. I know you can hear me loud enough, but definitely welcome on in, Mom, and stuff. I love you. Thank you for starting to watch and everything and stuff. So like I said, that's nearly 1/3 of all 85 plus year olds will have some form of dementia. And remember, Alzheimer's is dementia, but they're not the same. Alzheimer's is the disease, and dementia is what it has. All the stuff that it's describing is that. Thank you, Pastor Carol said, teach Nurse Ellen. Yes, I'm going to do my best, my dear. and stuff. So then common signs and symptoms that you may have dementia or Alzheimer's or a little bit of both, and stuff. Early symptoms. This is called early snitching. Your body is a snitch, believe it. The reason why I say that is because it tells on you. So it's going to give you some early symptoms. It's when you don't listen, then it get raw with you and stuff. But the early symptoms is forgetting recent conversations. This is early. Just simple things like forgetting recent conversations, misplacing items. Now, we all guilty of that and stuff, but it can't happen every single day and just be all right and stuff. But we all guilty of, where my glasses at? Where my glasses? I know there ain't nobody stole my glasses. Did I leave them at Walgreens and stuff? Where my glasses? Oh my God. And stuff. Oh. Okay. I'm just saying, and stuff. Yes. Cousin Maria says short-term memory loss, and Rosie Granny Allen says she watching in Jesus' name. Amen. Thank you. Amen. Because we got to watch out, because I'm gonna be watching you. I'm gonna be watching you, little Miss Rosie. But misplacing items, repeating questions. Hi, baby, how you doing and stuff? Who is this? This your little baby? Oh, okay. Oh, she's so cute. He's so cute and stuff. And then y'all sitting around for 30 more minutes. Y'all watching the TV or something, watching the game or something like that. Y'all come back. Hi, baby. Where you come from? When you get here? Who are you? Oh, is that your little baby? Oh, is that your little baby? Oh, you got a baby? And stuff. Yeah, something happening. I'm just saying. Pastor Carol said, can menopause trigger a type of forgetfulness too? Because when you're in late 40s to 50s, actually it can. And that's why it would be more of a dementia, unless you know of somebody that already had Alzheimer's disease. That means it runs in your family. Then you will fall under dementia, which is actually, okay, I ain't gonna tell you yet. But anyway, it will fall under that. So give me a second to get to that, Pastor Carol and stuff, because that does make sense and stuff. And I'm gonna make sure that I give you the real answer and stuff, and not just something I'm guessing or anything like that and stuff. Rosie Green Allen said, my, say that. Yep, I'm gonna be watching. And it sounds like you might get a chance to go play bingo or something. And so that's where that comes in at, definitely, and stuff. So then I said difficulty finding words. So sometimes they'll stop speaking because they can't even find the words, or they'll take the words and do what I call gibberish. They'll mix them up. It's like word salad. They'll have the balloon with the cat and the mouse on top of the mountain, and stuff. You like, yeah, I don't know what that means. Yeah. What you mean by that and stuff? Yeah, don't try to find out. It's going to make you demented trying to find out what they talking about, because only they know that secret's awesome sauce that's in their brain that made them say that. And stuff. They're remembering things that they do remember, and stuff. And it's something weird and stuff. And then also about that memory loss, I'm almost on my way to that, cousin Maria and stuff. You said, Pastor Carol said, because people mix these things up. Oh, awesome. And thank you. Oh, okay. Yes, they do mix them up. That's why I want to talk about it, because a lot of people, oh, she just demented. She got dementia and stuff, and it might be Alzheimer's, or oh, she got that Alzheimer's. They call it Alzheimer's. It's Alzheimer's and stuff, but they call it Alzheimer's. It don't matter and stuff. It's old timers, whatever they want to call it and stuff, because it do get you when you get older, and stuff. Most of the time and stuff. There's a couple cases where everything is abnormal because we all different and stuff, and so that's where that comes in at and stuff. But difficulty finding words, so they just stop speaking at all. And losing track of appointments. They used to have it all together and, have a whole list. Now they can't remember nothing Nothing. So that means that the caregiver or somebody else needs to be involved so that they can make sure that they making it to these appointments and everything, because they're going to start forgetting them, and stuff, and you want to be ready. And so that's where that comes in at and stuff. So moderate symptoms that you might have, Alzheimer's / dementia, because they're two different things and stuff, is confusion about time and stuff. And somebody near and dear to me and stuff, their father, before he passed away, he had, I believe it was dementia, but it could have been Alzheimer's and stuff. I'm not sure exactly and stuff. But I came up to my friend's house and stuff, and he's sitting on the stoop, outside checking out everybody. And he told me to hurry up and get around the corner. He told me to get around the corner before them street lights come on. And when he said that, I was like, Mr. So-and-so, I'm grown. I'm not a little kid. But he recognized my face. So that's that long-term memory. But he didn't recognize the short term that I was grown already, and stuff like that. So he's trying to send me around the house, before the street lights come on. And I was like, oh, but I thought that was the cutest thing. And that has stuck with me forever. Pastor Carol's father. But anyway, Pastor Carol said, because people mix things up. Okay. And then it says, can you do mind exercises like crossword puzzles? Y'all getting ahead of me and stuff. But yes, you right. You walking down the street. You're walking down the right street. Pastor Carol and cousin Maria and stuff. You guys are walking down the street and stuff. That's exactly what's going down and stuff. And you'll hear it in just a second. So they also have personality changes. So they're not trying to beat the hell out of you and stuff. They get irritated because they don't know why they don't know and stuff. So they're frustrated. They're miserable because they don't know why all of a sudden, who is everybody? I don't know. Yeah, that got to be frustrating. You would be frustrated. Even when you didn't buy, I did the demonstration of having the glasses up here and stuff. Where my glasses at, and stuff. I'm saying that to say that that's every day, all day long for them. Yeah, it's bad. It hurts and stuff. So as I'm doing that, increased anxiety. So that's another reason for them to, you like, oh, what the, and stuff. Yeah, because they worried. They don't know what to do. So they might just scream, they might sing, they might be, what we call pleasant and stuff. But either way, you might have to find out what's really going on and stuff like that. They're going to have difficulty managing their finances. So somebody else is going to have to come in and take over and hook this up so that they can keep going and stuff. And then difficulty cooking. They leaving the pot on there and walking away and stuff. And they got their little sandwich and the fire alarms going off, smoke alarms. I did that too the other day. I was really mad and disappointed with myself. But I mean, it wasn't this, but I'm just saying that got to be frustrating, for somebody to be living by themselves all this time. And then that happens to them and stuff. And I'm not living by myself and it happened. And we was all sitting in here and it was smoky smoke and stuff. So it happens. I'm just saying. And then there's advanced symptoms. And that's when you're unable to recognize family. I don't know who my daughter is. I don't know who my son is. I don't know who this or that, my grandkids. Pastor Carol said overspending, yes, or even forgetting to eat or eating too much and getting sick and then don't even know what to do. Then you got your wet in the pants or taking a number 3 or 4 on yourself, and stuff like that. It's all of that, stuff and everything. This is for advanced symptoms when it comes in, like loss of bladder and bowel control or poo-poo and pee-pee control and stuff. Difficulty swallowing. You put the food in, you're supposed to swallow it and let it go down, but they can't. Now they choking and it's going down the wrong pipe and they don't have enough power to choke it up or cough it up. So it just stay down in there and give them pneumonia and stuff like that. That's where that comes in. It's called aspiration and stuff. And then there's complete dependence on caregivers. Now you just gave up. I'm done, and stuff like that. Now you got to depend on that caregiver, and that caregiver does all the work and stuff because you can't. So it's only natural that somebody in their right mind comes in to pick up the pieces or is hired to pick up the pieces. It don't matter how you get your caregiver, that you get a caregiver, and stuff, when you know that, yep, I'm done. And even if you don't know and stuff, they'll probably figure it out by the time you stop making all your appointments and you stop going to this and going to that. You can't drive no more. You can't do this. You can't do that. You're having falls. You found outside and don't remember why was you outside, and don't remember why you was at the store. What am I supposed to do here? What is this place? And you've been there 30 years in a row and stuff, and now you don't remember nothing about the place, or something. Yeah, you found it, but you don't remember. So that's also dangerous and everything. And warning signs that should not be ignored. Okay, so this is your body is a snitch love for you. And that would be repeatedly asking the same question, getting lost in familiar places, forgetting family members, even your daughter and your son, or two sons, two daughters, I don't know, and stuff. Leaving stove burners on. And it's 98 degrees outside, and you didn't start cooking in the morning and made you something and left the thing on, and it's hot as I don't know what in this house. This makes me sick. You did it, but now you got a problem. There's a reason why you did it and everything. Poor judgment, not even knowing that you probably shouldn't go outside naked and stuff. That's probably a problem. Grandma shouldn't go out in her nightgown, and grandpa shouldn't go out in his boxers, and stuff like that. And or great grandma and great grandfather, however that looks and stuff. And then sudden personality changes. First you mean and you knock the living daylights out of anybody, and then you're acting like a little baby or a little kid throwing a fit on the floor and stuff. We don't know what's going on and stuff, but it's getting down and it's getting hectic and stuff. And then how is it diagnosed? Well, first they want to get a medical history, and that the questions for a medical history exam, they ask the questions about your symptoms. What are these symptoms and stuff like that? And then they check them off. This is the doctor. This is not Charlene, Nurse Charlene or Nurse Allen and stuff. This is the doctor. They want to know about your symptoms so that they know which boat to put you in, or what avenue to take. Then you get a physical examination. This just checks you overall. Are you healthy as a whole, and stuff? You got good muscle, good skin turgor. You're not dehydrated, and stuff like that. You're not neglected or, pissy or shitty, or something like that and stuff, things like that. Then there's cognitive testing. This is the one that tests your memory and your thinking, your ability, and how do you think. If it has switched up and it's not for you, 81 years old and you not with it at all and stuff like that, they'll be able to tell by this one. And it tests your memory. What do you remember and what don't you remember? Like long-term and short-term memory and everything and stuff. And then also they give you thinking tests. Like when you come in, they might tell you this, remember these 3 words. And then they talk to you and stuff and blah, blah, blah and stuff. And then they ask you that again. What was the second one? And you like, I don't know, dummy, or something like that, and you start getting irritated. You probably got some dementia going on, or it might be Alzheimer's. It could be either one. Then they do other blood tests to rule out vitamin deficiencies, like is your potassium down, your magnesium down, your vitamin D down, your, and stuff, your B vitamins, or how are they popping, and stuff like that. Also, thyroid disorders will take you into some type of demented stage, which is not Alzheimer's, but dementia stage and stuff like that. And then infections, they cause confusion and stuff, so even a simple infection like a urinary tract infection, I had one and stuff, and I was having hot flashes and everything and stuff. But guess what? My mother told me this all the time and stuff, and I will never forget this. And she told me this just recently. She said, you know what, when I found out something was wrong with me and stuff, it's because you always said on your podcast that, have anybody ever peed and then look back at your pee? Don't just leave. Don't just leave. A man, you pointed towards it and stuff, but don't just leave. Look at the color. And if you got just plain clear water in it, if you turn it golden brown or orange, you probably got a problem. Same thing with a woman. If it's not, yellow and stuff, vitamins will turn it like a neon yellow and stuff, a weird yellow and stuff like that sometimes and stuff. Or certain medicines can turn it orange or, different colors and stuff. But for the most part, you're supposed to look back at your pee or your poop. Even if it's diarrhea, you want to make sure it ain't diarrhea and blood. You want to make sure your poop is brown and not white or green or something like that. You want to look and stuff, because green can mean just vegetables. You got enough in there that you was plugging in vegetables. So that type of stuff. And then what did I want to say? Yeah, and so another thing for treatment, this is treatment of it, is brain imaging, a CAT scan, CT scan, MRI, magnetic reasoning imaging, or something like that. A PET scan, which is another CT scan, but it goes a little bit further down a rabbit hole to find out what's really, really going on. And it costs a lot of money and stuff. But if they ever ask you to do one, don't pass it up for nothing in the world. Whether you want to find out or not, get it done if the doctor orders it and stuff. So treatments. There is currently no cure for Alzheimer's. Y'all heard that? I'm doing this and stuff. There's no cure for Alzheimer's and stuff. So you need to definitely... it will behoove you to make sure that you're looking at the medications that can slow it down. They said no cure, but they got something to hold it at bay. So it takes a little bit longer to kick into them real bad ones, because there's no cure currently and stuff. It got to take you out of here sooner or later, and stuff like that. So they got things like these Ariceps and different medicines, about 4 or 5 medicines. Ain't no sense in getting all into it and stuff, but just know that they got medicine to slow it down. And for some dementias, they can reverse them, and stuff. But the Alzheimer's is not reversible. So definitely it will behoove you to just catch on early so you can have a better quality of life, because that's the biggest thing. The medications may help memory and thinking temporarily, but lifestyle changes is the good things. Regular exercise, we got to get into it no matter what and stuff. If you haven't started yet and stuff, start now. Little things and stuff to build up to that bigger thing. No, you don't have to run a 10K or whatever race or nothing like that and stuff like that to be healthy, because some of them can pass away too. It depends on how your disease process is. It's just putting one foot in front of the other. I will not sit down for at least 20 minutes a day. So I'm gonna walk around the house. I'm using my housework as a exercise. It's still an exercise. You moving. You're sweeping, you're vacuuming, you changing the bed, you climbing over something and stuff. That helps and stuff. So don't sleep on that and everything and stuff. Healthy diets. They have a Mediterranean diet, and it just consists of, it's a Mediterranean style, but it consists of everything except for it doesn't have meat. So it's fruits and vegetables. The meat would be the fish, like a salmon or something like that, a fatty fish or something like that. And then nuts, like, some type of peanuts or walnuts, pecans and stuff like that, almonds and stuff. And then olive oil, avocado oil, and the different kinds of oils and stuff. Some are a lot healthier than vegetable oil. It's low on the totem pole. We still use it, or I do sometime and stuff. It's low on the totem pole, but yeah, just try to find a way to phase it out. It's just like smoking cessation. Take your time and phase it out. Don't destroy yourself over it. It's too late for that and stuff. Just like I said, phase it out. And then that Mediterranean style diet will cause you to have better mental stimulation. And then Pastor Carol and cousin Maria and stuff, the keep the brain active through reading, puzzles, crossword, and Sudoku, and all those little funny things and stuff. A lot of games and bingo and stuff. You got to be up on your stuff or they'll knock the. Nah, I'm just playing. But they be mean at bingo and stuff. I went one time and I think I might have said bingo or something. And I think somebody had to walk me to the car or something like that. They was going to kill me or something up in there and stuff. But you got to be on your stuff. So when you doing that bingo and stuff, you got to be ready for it and stuff. You got to go a few times, watch how it's played. Because them people is up in there, they sharks. I'm telling you and stuff. So, stuff like that. That'll keep your mental capacity, and stuff. It don't hurt to go to the casino. Just don't make it a habit and stuff. But, things like that and stuff will help you. And social interaction. Day programs for the older people that have a caregiver. So they passed all this other stuff I'm talking about. And they have a caregiver. They didn't already found out, and stuff. They need to go to that and have a little music and listen to somebody play a piano. It might bring back an old memory, a pleasant memory and stuff. They feed them good and stuff like that. So it's good stuff. Pastor Carol said reading. Thank you. Bingo. That's a fun one with numbers. Absolutely. Because you end 35 and 72 or something like that and stuff. That's where that come from. And then getting you some good sleep. Not put them to sleep forever and stuff. Getting them some good healthy sleep where they're sleeping and stuff. Because guess what? When they're confused, they don't know how to go to sleep. So they just sit there with their eyes open. You got them trapped in the bed and their eyes are just open all night long. So they don't get no sleep. And then they grouchy and they want to knock the living daylights out of you and stuff. So you got to watch that. Give them something to do. And then, let them get a project going so that they can go to sleep. They like to paint. I like to paint and stuff. I know what I'll do and stuff. I'll find me some stuff to get into and stuff. Oh, yes. Cousin Tony said, yep, that's right. And stuff. Give them something to do. And stuff. And then there's caregivers. I got to go ahead and push this through, y'all, and stuff. Caregivers. And the challenges is, families often face this when trying to who going to take care of mama, who going to take care of dad, who going to take care of both of them, and stuff like that at the same time and stuff. And you want to do it because you remember they love you and they took care of you and everything and stuff. But it's a whole nother world. And if you ain't got no training, you don't know what this is about, it would behoove you to watch a podcast or watch, get on social media, on YouTube or whatever and scroll through that stuff and find information out about how do you do it. Because it's a whole nother ball game when you start taking care of somebody and they don't even know who you are, and stuff like that and stuff. This stuff gets serious and it's a real deal and stuff. So when I'm saying that and stuff, a caregiver will face emotional stress. Why they acting like that? Well, if you took the time to find out, because they got it now and stuff, you wouldn't be scared. You would actually take control of it. No. We're going to sit down. We're going to sit down and stuff. Now, come on, let's play this game. And you sit there with them and play on the computer or, on their phone or something like that or something, a tablet where it's bigger, where they can touch stuff. Even if they get it wrong, so what? They trying to play, and stuff. So that's the good part. A caregiver will face financial strain. I got to buy this and I got to buy this and I got to pay somebody to come in here because I got to go and take care of myself too and this and that and this. I'm just saying, this is what you face, and stuff like that. Guess what? I'm a caregiver and stuff. It's not of this and stuff, but it doesn't matter. A caregiver is a caregiver is a caregiver. When you're taking care of somebody else and their problems and stuff, sometimes you neglect yourself and stuff. Mine was a good one because I lost a lot of weight. But I starved myself and I started finding out that I was getting dizzy and stuff. And then guess what? The patient had to take care of me because I'll be acting up and stuff because I don't have it all together every time perfectly because I'm a human being. So I got to give myself grace. But did I get it back together? Heck yeah. And stuff. So the moral of the story is take care of yourself, even as the caregiver. Eat too. And so, this is a prime example real quick and stuff. When you're on the airplane and they might be in emergency mode or whatever and stuff, they tell, when them things drop out the ceiling, they tell you to put one on first before putting one on your kid or your auntie or whatever, and stuff like that and stuff. So they're saying that because you cannot pour from an empty cup. I can't pour you some and I haven't even gave myself some and I'm dry. I can't pour you fluid and make sure you hydrated and I'm dry and ready to fall out and I'm dizzy and you got to take care of me and stuff. I'm the caregiver, so I got to make sure I get mine in too, and then make sure you get yours. So if I'm fixing the food for this, that, and the other and stuff, I got to fix the food for me. I got to have a plate too with everything on it and stuff. If you doing a lifestyle change and you changing the diet, I got to have my diet. I got to have some fruits and vegetables, whether I want them or not and stuff, because I got to live just like they got to live and stuff. So that's my spill on it and stuff. Another thing that a caregiver will experience is burnout. It's just going to happen. Don't feel bad about yourself and give yourself a little grace, because it will happen, because you're putting somebody ahead of everything that has to do with you and stuff. So you got to make sure that you put them ahead, but sometimes that appointment got to be pushed off so that you get your appointment that day and stuff. If it's not that important, push that bad boy off and take your appointment and then get on back on track and stuff like that. Get your stuff done and stuff. Cousin Antoinette said, yeah, taking care of someone with dementia is real work, especially when they stop recognizing faces and names. Yes. And that's another thing. I know it seemed kind of petty, like they don't even remember me. I shouldn't take care of them. Did they say that when you didn't know how to say mama and dad or whatever? And so you can't do that to them and stuff like that. But it behooves you, you got your right to be mad at whatever you want to be mad at. But definitely think about it. Do they want to be like that? Probably not and stuff. So just give them a little grace too, and give yourself grace. Grief, sad. You feel isolated. You feel alone. It's all, I don't have no time and stuff like that. Make it. Because guess what? I got checked by a few practitioners and stuff like that. You'll make the time. You make the time. Okay? And stuff. And then exhaustion. You get so tired that you burn the butter up the other day twice in a row and stuff. Burn the butter. I didn't know butter cooked so quick anyway and stuff. I was trying to be healthy and stuff, but I burnt the butter. Had the little seasoning in there. I turned around and go get the little shrimp and stuff and come the sink in the stove right there and stuff. I turn around, the butter is black. I'm like, what the? I'm just saying. So exhaustion, and it could have been that, because guess what? I was thinking about 15 other things while I'm grabbing these shrimp and rinsing them off slowly, and my butter is burning right on the side of me, and I don't even smell it, until I turn around and it's a poop of smoke. It wasn't on fire, but that's what I'm saying. Yeah, that burnout is cold, and it'll sneak up on you like dementia and everything. Sandra said, burnout right here, still trying to catch up. Did it for mom and dad. Exactly. Prime example. That's what I'm saying. It's real people on here that's having these real problems that then found the faith around and found out, and stuff. I'm not going to not take care of my dad. I'm not going to not take care of my mom especially if you had a good relationship, or even if you didn't, you just got that respect and stuff. You're going to try to take care of them. You don't want them to be in some, home unless you have to put them there. But I'm just saying and stuff. And it does cause burnout. And if you didn't get burned out, something wrong with you and stuff. Because as a human being, when we put everything ahead of, you could get burnout being a mother of 3 or 4, and stuff like that. And they all smaller, and stuff like that. And you got all of this and stuff. You always gonna put yourself last and stuff. And then, 3 or 4 and a husband and a wife. And you doing this and you always doing something. When you get home from your 12-hour shift or something like that, or day and stuff like that, then you got to come home and you got to try to do the kids' homework because your wife is all burnt out from being at home with them all day. And yeah, it's a such thing. And if you don't get burned out, I'd like to know what's in your DNA that's causing you not to do this, except for not giving a fiddle faddle and stuff, because it's really that serious. And so after saying all that stuff, I'm going to get down to the end and stuff and get you guys on off of here and stuff. But thank you for joining. I thank you for really paying attention to this, because as you can see, you can look this up. You don't have to worry about me and taking my, advice and stuff. Look up what I said and stuff. That's all I'm saying and stuff. See if it measure up, to something. Of course, I didn't cover every single perfect base and stuff, but just look it up and stuff and see that it was at least a blessing for you and stuff, and something more than you knew yesterday and the day before, and stuff like that. Some of the stuff you already experienced, as we see, as a few caregivers on the line and stuff like that and stuff. But if you've never experienced burnout, there's probably something wrong with you. And it's probably a mental illness, because to be able to block that out and stuff, you got to be really, or I guess rich, and then you could get somebody and pay somebody else to do it. But at the same time, when they pass, are you gonna cry, and stuff, because you got somebody else to do it instead of you doing it, and stuff. So it's the whole little thing in that. Where's your grief? Where's your everything and stuff. So that's my spill on it and everything. Thank you, Josie. She said, thank you for all the good information as always. Yes. And Sandra, thank you and stuff. She said, thank you and stuff. Sandra and T and everybody that got on and stuff. I ain't forgot or misplaced any of you guys and stuff. I appreciate you, and everything and stuff. And so I got my take home message. And this is really good, because this kind of summarizes everything that I talked about today and stuff. It's a take-home message and a conclusion, and it's just one page. And that is, dementia is a group of symptoms affecting memory and thinking. You hear that, you guys? Alzheimer's disease is the most common cause of dementia. That means that Alzheimer's disease does everything that dementia, they say dementia is. It affects your memory, your thinking, your ability to talk and remember things and all of that stuff. Now, this is important. Early diagnosis matters. If you want a good outcome later on in life, get it while you're in your right mind. It doesn't matter your age and all the ages I gave you. Everything is not a perfect science, because we different. And stuff like that. So just get it while you can and stuff. And then also, healthy lifestyle choices may help reduce risk. They will absolutely. You can turn up, but how long? That's why they have alcoholic dementia, where, you drink so much and stuff like that. And they turning up and they partying and stuff like that. And after a while, you find out. And stuff, when you're trying to get off and, what is it? Wean yourself off, or, jump on the bandwagon and stuff to recovery and stuff like that. Memory loss severe enough to affect daily life should never be ignored. It's snitching. Your body is snitching. If your memory loss is so bad that you can't even function no more, you better tell on it, and somebody better be watching and stuff, because it's a problem. You might not make it. It's 911 worthy. Families and caregivers play a critical role in care and support, Auntie Sandra, and stuff. So that's where it is. So you're not wrong for still feeling burnt out and, for mom and dad, but you did what you had to do, and God is looking. He's pleased. Okay? That was an unselfish act and stuff. There is currently no cure, but treatments and support can improve your quality of life. You hear that? It's called the quality of life, meaning that you don't have to be in a rut and in a rundown, nasty, abusive environment and stuff. The quality of your life means that it can be nice and things can be pleasant for you. And somebody else is taking care of your bills. You don't have to worry about that, but you can sit there and watch that TV and know what's going on there. Play that bingo until you can't no more and stuff. Get on those little crossword puzzles and have your feet up and you relax like you at Club Med, and stuff like that. That's okay and stuff. It's still a better quality of life. 3 to 4 square meals with a couple snacks in between, but small enough for you to just be okay and stuff. Good bowel movements, staying hydrated and stuff because your caregiver is taking care of you and stuff. That's a good thing. That's a blessing and stuff, no matter what stage of it you're at and which one you have. And they are two different things. So then last but not least, the brain is the control center of the body. When memory, thinking, and judgment begin to change, it's often the brain's way of signaling that something is wrong. Alzheimer's disease and other forms of dementia do not happen overnight. Do not happen overnight. They often begin with small clues, forgotten conversations, misplaced items, confusion, or changes in behavior. Snappy or just quiet or screaming, I hate you. I'm going to kick you, and stuff like that. The key is recognizing these clues early, seeking medical attention, and supporting those affected with compassion, patience, and dignity. So what, they peed on themselves? So what, they pooped on themselves? Clean it up and y'all going about y'all business, and you get to live and they get to live and stuff. You don't want to be the one to yell at them and stuff, and then you wake up and they don't and stuff, and then I'm just saying and stuff. So patience and dignity. Every person living with Alzheimer's or dementia deserves understanding, respect, and quality care. Thank you guys very much. I kept you until 8:30. Anybody that got on later and stuff can catch the replay. My topic was just giving you a brief overview in layman's terms or simple terms on dementia versus Alzheimer's. They are not the same thing and stuff. That was the whole point of bringing that up. Like, you crazy and having a mental illness, they are not the same thing. Crazy is not a diagnosis. Crazy is slang. Like, you stink, you ugly, or whatever and stuff like that. It's not the same and stuff. So we got to stop treating it like it's the same. And so we give things a name and then don't even know what they mean. What if you crazy and you calling everybody else crazy? What if that man digging in the garbage can turn around and call you ugly, crazy, dirty person, and so it's like, nah, that's you. And stuff. But that's what I'm saying. What if they called you that? So you be ready to knock okay. But anyway, I'm saying all this to say that I like to try to keep it lighthearted. I like for you guys to join in and talk the talk and everything and stuff. And hopefully just a little piece of what I got might help those caregivers that's in the middle of doing this and stuff, and everything and stuff. It's all different. Your caregiving can change from time to time and stuff, depending on who it is, and stuff like that. But the moral of the story is to be able to have that, make sure they have their dignity as you keep your dignity and stuff. Make sure they have quality care. Make sure you make it fun so that you get a treat out of it and you get a crossword puzzle too. You might need one. Or you might get early onset dementia or stuff like that. So doing that and stuff, I'm telling you, it go a long, long way and stuff. And you guys, you can make it. I am. We can make it and stuff. So when I teach you, I teach me. So that's why I make sure that I get thorough, and I'll be like, I got to push this out. When I do that and stuff, it's not to be greedy and stuff. It's to make sure that I get that to you, because what if I save somebody's life tonight with that information? Save that caregiver's life because they burnt out, they overworked and stuff, and underpaid and underappreciated and all of that stuff, and it's not right for it to just fall on one person. If there's a family village, and stuff, it should be a little bit of everybody putting a little work in and stuff like that to get to the other side. And so as I sign off, I thank you guys for your time, for spending it with me this evening. I come on every Tuesday, unless otherwise, God doesn't permit and stuff. I come on Tuesdays at 7 p.m. I do about an hour to an hour and a half at the most of talking and walking you through it, depending on how important the subject is. And I just hope that I help somebody. And I pray about it before I get on and everything. But you guys take care. Take care of yourself. Remember, on the airplane, they said, put your mask on first, then put the next person mask on. But you do you first. You can't pour from an empty cup. Meaning you got to take care of you. You got to hydrate you. If you think enough to hydrate that person, you got to hydrate you. If you think enough to bathe that person, you need to bathe too. Because you might be musty and offensive to the patient, and stuff like that and stuff. So with all that being said, just remember, your body is a snitch. Always believe it. It can't tell you a lie. Okay. Thank you guys. And y'all take care and stuff. I appreciate you. Okay. And wait. Auntie Josie said, thank you for all the good information as always. Auntie Sandra said, thank you. And I know that's coming from Sandra and T. Thank you, ladies. And cousin Antoinette said, thank you, cuz, as always, great job. Thank you, cousin. And Dad said, great job. You're doing great. Oh, I appreciate you. Thank you, Dad. And stuff, and everybody else that got on, I haven't forgot you and everything. And stay tuned. About 5 minutes after the live is over and stuff, then you'll be able to watch the replay. And then a little bit shortly after that, if I get the time tonight and stuff, I'll try to go through and answer and put stuff inside the comments and stuff, and you can find information out. And I thank all the participants and everything. You're appreciated. And take care. All right. And take care of your family. Yes.